Good afternoon. My name is Marina Bolser. I'm from the University of Florida, and today I'll be presenting on HIV/AIDS in Belize. So a bit of a background on Belize. It's located on the east coast of Central America. It borders Guatemala and Mexico. It is ethnically and culturally heterogeneous, especially depending on what district you go to in the country. The government is a parliamentary democracy. The current prime minister, newly elected this week actually, is Johnny Briceño, a member of the United Democratic Party. Its economy is, its country comparison to the world is 187. Additionally, much of the economy is made out of the service industry and tourism. A bit of an overview with the population related to HIV/AIDS. So the general population is about 400,000. The life expectancy is roughly 75 years, and the median age is 23.5. So Belize is actually a very young country. 75% of the entire population is from ages 20 to 49. So it is a very young country. The population with HIV in 2016 was 3,665 people. However, estimates from 2020 roughly estimate it's closer to 4,900 people as opposed to 3,600. The HIV incidence in 2016 was 225 people. And similar to the population, dissimilar from the population with HIV, the HIV incidence has remained steady from 2016 to 2020, so roughly 200 infections every year. The HIV deaths per year are also remaining steady from 2016 to 2020 with roughly 100 per year. So you've got, for every 2 infections, you've got 1 death. So that's not a great outlook if you've got 50%, right? So the districts most affected are Belize City, Stan Creek, and the Cayo district. Most of the country resides in the Belize City district, in particular Belmopan, the capital. I would like to touch on a moment Stan Creek. Stan Creek has a very large population of immigrants, mostly Guatemalan and Honduran immigrants. And part of the reason why HIV incidence and rates are so high there is because many undocumented immigrants fear seeking healthcare services because they do fear being deported. We have seen scenes in the Dominican Republic and San Domingo where people are armed, there are armed guards outside hospitals. This is not the case in Belize. There is legislation passed where anybody can access healthcare and will have no fear of being deported. However, many undocumented immigrants have seen those images in San Domingo and the Dominican Republic, and so therefore they fear that they will be deported if they seek healthcare services. So the immigrants in Stan Creek are a very hard population to reach in terms of HIV prevention, education, and treatment. And finally, the Cayo district. Stan Creek and the Cayo district sort of compete for second and third place in terms of incidence and rate. They're roughly equal. It just depends on the year who is second, who is third. Some at-risk groups, we've got men who have sex with men, young people having casual sex, transgender individuals, undocumented immigrants, particularly those in Stan Creek. Some other populations of note are persons in prison, people in the military, and sex workers. I'd especially like to focus on men who have sex with men. Male-to-male contact accounted for roughly 66% of new infections in 2016. And similar to incidence and deaths, that has remained stable until 2020. So men who have sex with men are an extremely high-risk group, if not the single most high-risk group in Belize. There are an estimated 10,000 men who have sex with men and 6,000 transgender people in Belize. However, this is just an estimate because it is very hard to reach LGBTQ people because of stigma. Stigma is the biggest barrier to reaching men who have sex with men for treatment. There still exists anti-LGBTQ legislation that criminalizes sodomy. It's very difficult to pass legislation that advocates for LGBTQ rights or that would overturn the sodomy law, simply because it's a very religious country. 40% of the population, roughly, is Roman Catholic, and roughly 30% of the population is Protestant. So we've got about 70% of the population that has anti-LGBTQ tendencies. So it is hard to get over that legislation or pass new legislation. And stigma, that could be familial stigma, that could be even self-stigma. Additionally, community stigma is a big factor. Many people live in small communities, and everyone knows when you go to the heart doctor, everyone knows when you go to the eye doctor, and everyone knows when you go to the AIDS doctor. So for people who may want to seek treatment, they may fear the stigma from other people, so they don't seek treatment. So stigma is an absolutely large barrier to reaching the LGBTQ population. Okay, let's move on to some education and prevention programs. There are many outreach interventions in Belize, and education prevention is predominantly the domain of civil society actors. However, the national response is a combination of state, non-state, domestic, and international forces. I like to think of the AIDS response in Belize as like this hodgepodge of all these different actors coming in, piecing together whatever they can. There's no real unified national actor, international actor taking action in the country. So the National AIDS Commission, if there was a unified actor, if there was a main actor, I would say that it would be the National AIDS Commission. The National AIDS Commission is sort of an organizing body through their Civil Society Hub, which is a new addition, of all the smaller HIV/AIDS organizations in the country. The Civil Society Hub acts as a funnel of all the international funding to go through it and then to be dispersed amongst these smaller organizations, which I will cover in the next slide. The National AIDS Commission targets at-risk populations, so they make programs directly directed towards men who have sex with men, directed towards people who have casual sex, who are young, directed towards transgender individuals, et cetera, et cetera. They have a more holistic model of HIV treatment. They focus more on the human connection, the human aspect of HIV treatment, and the why. Why somebody wouldn't take their ART, why somebody wouldn't use a condom, why somebody wouldn't get tested. And addressing that why is part of the National AIDS Commission's ethos and philosophy. They're funded internationally, and they work with the UNDP. They're mostly funded by the Global Fund. So IEC stands for Information, Education, and Communication, and that is a part of the National AIDS Commission. And some IEC initiatives include POWA, which is located in Stand Creek. It focuses on the empowerment of young women and girls. There's Go Belize, which is a youth organization, the Belizean Military HIV Prevention Program for the military. Youth Enhancement Services is another youth organization, and the Belize Family Life Association and the Pan American Social Marketing Organization, domestic and international, respectively. Those are both IEC leaders. They are quite prominent in the country when it comes to IEC. So the Ministry of Health. The newly elected Minister of Health is Michelle Chabat. And the Ministry of Health's ethos is to go into the general public. They do not necessarily target specific populations such as men who have sex with men. They would rather take their education and prevention initiatives and spread them across the entire population. They focus on the medical model of HIV treatment, testing, ART, et cetera. And like I just said, they're focused on testing. You can get your results at their clinics. Anything medical or of that nature, the Ministry of Health, that is their domain. There's also the National Health Information Services, or excuse me, Surveillance System, which tracks STI rates and HIV rates across the country as well, and that is run through the Ministry of Health. Some challenges. So unfortunately, there are many challenges into implementing education prevention programs in Belize for HIV. For one, we've got legislation. Like I previously mentioned, there is that sodomy law, which makes it extremely difficult to reach the largest population of people with HIV, men who have sex with men. There is also a gap between the legal age of consent and the age that somebody can access sexual health services without consent of a parent. So that gap makes it we have this age of young people who cannot get sexual health services unless they have the consent of a parent, which means, of course, that they are less likely to use those sexual health services. Again, we've got stigma, a very religious country, and like I will keep saying this, the stigma and the legislation is a huge barrier to reaching the main population of people who have HIV. And this is the main barrier, the single most barrier that we have to treating HIV in Belize. Funding is always difficult because of so many countries that have HIV where it is a large problem. But especially now with COVID-19, I'll be going over that in a couple of slides. But funding is always hard to access, especially because Belize is considered a upper middle income country. They do not qualify for many grants that could only go to low income countries. Additionally, Belize has limited capacities, limited manpower, and just that fight for resources. Legislation, stigma, funding, and limited capacities are the main challenges to implementing and successfully seeing through the effects of many programs that exist there. So poverty, the poverty rate in Belize is 43%, which is very high. There's an inverse relationship between income and HIV incidence. As income goes down, HIV incidence goes up, same with rate of HIV. It is very difficult to adhere to ART with a lack of stability. I was lucky enough to speak to Enrique Romero, who was the executive director of the NIC, and something that he said really stuck with me. He said, we need to bring in social factors and intertwine them with our response to HIV. He said that he's very focused on the why, how it's very difficult for somebody to take ART if they do not have transportation, if they do not have a job, if they are struggling to put food on the table. People can be criticized for not taking their ART, but there are some needs that come before others in the eyes of many people. So his belief is that by addressing these psychosocial factors, then we will be able to properly reduce the rates of HIV in the country, but only if we address those psychosocial factors first. COVID-19 has essentially crippled the HIV/AIDS response. People living with HIV are afraid to leave their homes for services. There are logistical issues with ART and getting a 3-month supply instead of a 1-month supply. It's very difficult to do that because of government legislation. There's a lack of funding for obvious reasons. They did receive a $240,000 UNDP grant to kind of keep them afloat, but unfortunately, COVID-19 has really thrown a wrench in things. So the trajectory for the future. With the advent of the new, the United Democratic Party, the NAC is hopeful that their national strategic plans, collaborations with international organizations will engender a new movement using innovative strategies such as self-tests. So the attitude from the NAC, at least, is very hopeful. Now that there is opportunities for more funding, there are opportunities with international organizations working together. So though things may seem dire, there is an attitude of hope from the NAC. Here's a short PSA that I have filmed, similar to those that are sometimes used by the NAC.
In 2016, 3,491 people were documented as living with HIV in 2016 in Belize. HIV is an invisible virus, and there's no way to tell if someone has it from looking at them. If you're a man who has sex with men, or if you're a young person having casual sex, it might be a good idea to start using condoms. Condoms are a great, safe, easy, and effective way to protect yourself against the risk of HIV. Alto. Usa condom. Save a life.
Thank you for watching.